India, it's a sprawling country of a billion plus people. It is one of the world's fastest growing economies with a thriving middle class. Yet 26% of the population lives below the poverty line. 456 million lives on less than $1.25 a day, and 46% of children are malnourished.
Healthcare in India is government funded and government run, but for many people, accessing this healthcare is a big challenge nowadays.
So we have the larger group, in fact, much larger group of people who are poor. So we don't have the kind of means and the kind of healthcare. So this is the nature of the problem what India is facing right now.
The major problem in the public sector is lack of government funding. Total expenditure on health per capita is $109 compared to $7,290 in the US.
My own brother, he used to get seizures while he was in India, and he got them for a very long time, for around 4 to 5 years. Doctors in India always wanted to get medicines. They never preferred an operation or a surgery for it, and he suffered a lot. But then he had to come here in the US to do his master's. He was here in the 2008, and when he was here and the doctors saw that he got seizures even after he came here, doctors told that he needed a surgery, and he had a surgery in 2011. Since that day until now, he has never faced a surgery before.
Healthcare consumes 4.9% of Indians' GDP versus 16% in the US. The outcomes: long lines, fewer facilities, and inefficient staff.
So, I think the challenge probably is just making it affordable for everyone, right? Because if you look at the healthcare system in Canada, they need to go to hospital and, get their wrist, a broken wrist fixed or anything like that. Like, I don't think they even have to pay for anything, or maybe like small costs or something like that, but for the most part it's free. And so I think here in the US, nothing is free. Everything costs money, and a lot of it money. And so I think that's, probably one of the biggest challenges that people go back and forth.
Private sector, the doctors are highly skilled in the facilities world class. Indians are utilizing technologies like telemedicine to treat patients in rural areas.
In principle, people should get comprehensive, free, publicly funded and publicly financed healthcare. But in practical, they don't get those facilities and they have to put a lot of money from their pocket. So it will be more and more expensive healthcare in India.
Alright, I'm Mary Hammond. I'm a junior and I'm a health science major. The three advantages of U.S. healthcare system is that it covers the most vulnerable. Now, although 50 million people go uninsured in the U.S., the government still provides insurance for those who have a hard time providing for themselves. And for example, the Affordable Care Act, that allows children and young adults to be covered under their parents' or guardians' health insurance until the age of 26. The second advantage is that there are many options that you can choose from. So you can choose any health insurance that fits you financially. And the third is, again, although there being so many people uninsured, the lack of such insurance is a crisis here. And with emergency treatment and emergency rooms, no one can be turned down. And so I think that is a big plus in our health system.
Rather than providing big hospitals, everything for everybody, hospitals that have hub and spoke models. Hubs are generally the high-end super specialty hospitals, and the spokes are the hospitals with care for the Phoenix for cardiology, things like that.
So what advantage you have seen mainly here compared to more?
Infrastructure.
Mm-hmm.
That's one. Two, healthcare professionals. They are there. People, seasoned professionals are here. Then also, the fact that people could talk about it means they are knowledgeable enough about healthcare provision. Okay, they're not in the dark. So right now they just want to what extent is my right So they know about these things, so they can compare and contrast and decide on which one to go with. So the knowledge of it is also an advantage that I see here compared to my country.
I'm talking about the healthcare cost is very high when compared to India. Like we usually pay like not more than a $2 to $3 for a consultation of doctor. Here, as of my experience, my friend who was suffered from fever, so he went to primary care physician. They charged around $300 for the entire treatment, and even after he having a insurance, he need to pay like $200 for his overall medical treatment.
Now, the con of U.S. health system is that it's very expensive. That's one thing that you need all through life. You need healthcare, you need doctors, you need physicians to take care of you, to look at you, and it's such a shame that it's so expensive. So if that's one thing we need to work on, that's money. That's it.
Doctors are performing innovative procedures which attract potential patients from all around the world. With a growing middle class, more and more Indians can afford this kind of healthcare.